Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's focus on the nephritic syndrome. So we are looking at the nephritic syndrome. So this nephritic syndrome, with the primary pathology being there is significant inflammation of the injury to the glomerulus. So there is inflammation, primary pathology. There's inflammation of the glomerulus. So this is a nephritic. Whereas in nephrotic, there was no significant glomerular inflammation, but there was a significant leakage of the plasma proteins and a defect in the glomerular filtration barrier. So here there's a significant inflammation injury to the glomerular, resulting in the passage of RBCs. So due to the inflammation of glomerulus and results in the passage of RBC. So there's passage of the RBC and also the inflammatory cells and the PP, that is the plasma proteins. Next, looking at the principle of the glomerular injury. So in terms of the nephritic, we saw it was a visceral epithelial cells as a podocyte. Whereas in case of the nephritic, it is going to be the principle of the glomerular injury. Site will be the endothelial cells. So it includes the endothelial cells, the glomerular basement membrane. Next, it also includes the mesangial cells and also the parietal epithelial cells. So to get back, it is the endothelial cells, the glomerular basement membrane, the mesangial cells, as well as the parietal epithelial cells. Next, we move on to the hallmark signs. So what will be the hallmark findings of the nephritic syndrome? So in terms of nephritic syndrome, there is mainly the hematuria. And hematuria, it includes RBC cast as well as the dysmorphic RBCs. Next, we move on to there are varying degrees of the proteinuria and the pyuria. So there is proteinuria as well as the presence of the pyuria. Next is the renal dysfunction can be seen. So the nephritic, there is renal dysfunction as well as the hypertension is seen. So hypertension is common feature in both of them. Next is what are the associated glomerular pathology. So here in terms of the glomerular pathology, the GP, there is acute post-streptococcal glomerulonephritis. There is acute post-streptococcal glomerulonephritis, and there is a rapidly progressive glomerulonephritis. So this is crescentric and then the IgA nephropathy. So in terms of the nephrotic, it was a minimal change disease, FSGS, and the membranous nephropathy. Whereas here it's acute post-streptococcal glomerulonephritis, rapid progressive glomerulonephritis, IgA nephropathy. Next comes the membranous proliferative glomerulonephritis, as well as the Alport syndrome. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.